Welcome to EDSC 541. This is Psychopathology Week 2. I'm Professor Bobo, and I am here talking to you about chapters 3 and 4. A couple of things that are due this week. On Sunday, your first assignment is the contemporary mental health assignment, which is due. Also, please review the video that I did for week 1 that went over details how to search for a contemporary mental health law that has changed. I showed you how to do that, and then we talked about the class. The assignment specifically says that 1 page should be for description, and then you need to answer the rest of the questions that's listed on the syllabus for the assignment and what the assignment needs to include. Again, the assignment needs to be APA format with citations and references. It needs to be a mental health law that has changed within the last 5 years. So it is currently 2022. So we're looking to go back as far as 2018. All right, thank you so much. That's just a quick overview for our assignments this week. In the chapter, we're talking about the assessing and diagnosing. Again, one thing that I want to talk to you about as a school counselor is that we do not diagnose. So this is something very important to remember. So what is our role? Our role is to know about symptoms and know when to refer out to an outside agency that would provide an assessment and or a diagnosis for some particular symptoms that a child from elementary all the way to high school would be exhibiting from a mental health disorder. So we want to make sure we take a look at those basic things. Chapter went into basic elements. So what is the presenting problem? Is it situational or pervasive? So is this a problem that has happened due to the event of something, or is this a problem that is ongoing? The duration, how long has the problem been going on? These are questions that help us to give a diagnosis from the DSM. Were there prior attempts to help or treat the same similar situation? Is it self-defeating or resourceful? And how does the problem impact social roles? And does the problem match anything in our DSM-5 disorder criteria? So what is the relationship between assessment and diagnosis? So when we try to look at a situation or a case study, we see what is the presenting problem, and then we create a treatment plan, and then we need to have knowledge of the range of diagnostic problems, and then there's some form of payment, all right? So when we're getting ready to look at these different types of assessments, we talk about social and behavioral histories. A good assessment includes a social history, noting personality factors and social context. So we would use as school counselors this social history by gathering data from our students. Now, we again aren't going to assess. However, what we would be doing is taking a look at how the student is showing these different problems and presenting the behaviors in the educational school role. We also want to make sure that that the assessment is culturally sensitive. We want to make sure that there is an awareness in population diversity, that it follows our APA ethical codes regarding cultural competency, and that the cultural variabilities are there. So when we go into, we receive an assessment, our role as the school counselor, again, is to support that outside therapist the child would or student would continue with therapy after getting a particular diagnosis. And we want to see how to assist or support that therapist while the student is in our environment, and our environment being the educational setting. Some key terms for assessment: reliability, validity, and standardized. So those are some key terms that the book mentions, and those are very important. Another thing is, even though we won't be doing all of the diagnosis, we'll probably get a release of information to share information between the other therapists and you as a school counselor, and how you're supporting that student there. You want to kind of use similar strategies that the clinician has discovered, and then you'll work on some of the same things. Some of the things will translate well into the school setting, and some will not. So we have to do our best to get that type of information. It's important for us to build trust and rapport between the clinician and the client, right? Now, sometimes the therapist will go through several different types of examinations. There's a general physical examination, there's a neurological examination, and there's a neuropsychological examination. And these are the three types of exams that are done either by a clinical psychologist, a clinical counselor, an MFT. All of these people in their roles will assess. And then maybe we will go to a psychiatrist who would prescribe a particular medication. And again, when we share roles and we share that with a therapist and the organization that is and the person who is doing the assessment and diagnosis, we want to make sure that we have a clear understanding. Sometimes it is our role to ensure that the student is taking their medication at the school. So we'll need to know how to administer that and make sure it's being done properly. And what happens when they run out? And what are the potential signs when that happens? And what's our plan when that happens? Okay. So many psychological problems have physical components that are either causal factors or symptom patterns. Okay. So during that general physical exam, what the people will be looking at is the causal and the symptom patterns. During the neurological exam, they'll be looking at the EKG, the EEG, the tumors, the lesions, the electrical dysrhythmia. They'll look at a CAT scan, an MRI to see the enlarged brain areas. They'll look at a PET scan for organic processing, and then an fMRI, which is the brain mapping. So during the neuropsychological exam, it involves use of expanding arrays of testing devices. It measures our cognitive, perceptual, and motor performances, and it also provides clues to extent and location of if there is any particular brain damage. So there are a lot of different neuropsychological examinations that these different people will use. And so, you know, their tests will, in their results of their test that they give to the parent or to the student, if the student is of age, will go over the type of test they use, what it measured, and so on. So what role does psychosocial assessment attempt to provide? It provides three common procedures, which are assessment interviews, clinical observation of behavior, and psychological testing. So that's what psychosocial assessment does. All right. The assessment interviews are face-to-face and interactive. They're structured interviews, and they can be also unstructured. The clinical observation of behavior is watching the person in their natural environment So this is why MFTs go out and do that, because they see the child in the home, they see them in their other environments. A lot of times they will come to the school, especially if the school is seeing certain problems. So this is where we would, they would use these different environments. The clinical observations in therapeutic or medical settings, so they do it also in their own environment at their facility. And then self-monitoring and rating scales, which are usually given to the parents so that the parents can have, they can get some information from the parents. The psychological tests, there's two general categories of the psychological tests that are used for clinical practices: the intelligence test and the personality test. As we know, in the state of California, intelligence tests are not legal for African American students. Some of the most common intelligence tests are the WISC 4 and the WASC 5 for adults, and the Stanford Binet. And again, we don't use intelligence tests, so we use a different way of gathering that information as school psychologists when they do their assessment. So more of on the psychological testing, we do projective personality tests, and these are unstructured stimuli that are presented. Their meaning or structure projected on stimuli, and then there's projections revealed with hidden motives. So these are all the type of things that the school psychologist is trying to assess through these psychological tests, okay? And they give different types of them. All right. Each district gets to determine which test, and some districts limit their school psychologists as to what psychological testing that they can do. Like I said, for all districts in California, African American, it is illegal for African Americans to be given an intelligence test. All right. Okay, so then there's an integration of assessment data. And we developed this into our working model. And then an individual or a team approach is used to identify the picture and the discrepancy. Now we see this a lot with the school psychologists as they're doing their academic and psychological assessments for the students when we're looking for learning disabilities. And most psychologists only do learning disabilities. Some psychologists may be licensed, which means they are able to diagnose and do other things, but it will also depend on the school district, the role that they play. Again, with any assessment, ethical issues do come about. So we have to look at cultural bias, theoretical orientation of the clinician, underemphasized on external situations, like loud noise, things like that, insufficient validation, inaccurate data, or premature evaluation. We're noticing the premature evaluation with some of our students, we're noticing the premature evaluation with some of our students during the, you've got to be kidding me. We're noticing premature evaluations with some of our students during this pandemic, meaning that we haven't given them an opportunity to be in our environmental setting and to receive the instruction in a normal, natural setting. So that's an example of what we were talking about with the premature. So classifying abnormal behavior. So we talk about the introduction of an order, communication, establishment, statistical research and data, and clarification of different issues. So the DSM classification of mental disorders, we use the DSM-5, and it is a categorical system, and the classification is, and the definition of criteria is based on symptoms, which is subjective, and signs, which are objective. So the DSM-5 is more comprehensive, and it has more subtypes of disorders. It allows for gender related differences in diagnosing, and then it provides a structured interview regarding cultural influences. So it is a classification system. So some problems that come about with labeling of the diagnostic. Labels only capture the behavioral pattern. It creates an assumption among all clinicians, and it creates the social identity or the stigma, which we need to be fully aware of. All right, so when we're doing a diagnostic interview and it's unstructured, then we have freewheeling, and clinicians can follow a lead, and clinician pictures may vary based on the interviewer. When we're using a structured interview, it's controlled and it's determined if symptoms fit a diagnostic criteria. So issues in accepting of changes of the diagnostic DSM-5. The classification of personality disorders is categorical rather than dimensional, and it's unclear or limiting definitions of PTSD. So as you are aware, the DSM-5 has a new print, and the new print came out in March of 2022, just now. So this is what is the new system. Prior to this, we were using the DSM-4. We'll go over more information and look at the DSM-5. And then we'll also, like I said, as school counselors, our main focus will be on treating, our main focus will be helping students who have been diagnosed with these disorders. And our role is to use the information and using group therapy, and we'll have some case studies that we'll go over on how will we work with the student and what's our goal when there's a presenting problem. And what can we do to help the student overcome that presenting problem. So if they have a diagnosis of anxiety, we can't cure the anxiety potentially, but what we can do is give them certain strategies and ways to help them through our individual or small group counseling to lessen the anxiety while they are in the academic situation, so that they can flourish in their academic and social situation at school. Right? Thank you guys. I will see you week